So you get a fever. What's the first thing you do? Probably grab a thermometer, right? But for a doctor, a fever, it's so much more than just a number. It's really the first clue in a super high-stakes detective story. It's the body's way of screaming that something's wrong. And the doctor's job? Well, it's to figure out what. Let's jump in and see exactly how they crack the case. So why is a 101-degree fever sometimes less of a worry than one that's just 99? It sounds kind of backward, doesn't it? But, this question, it gets right to the heart of how doctors approach this stuff. The number on the thermometer, that's just one piece of the puzzle. The real story is in the context. We're talking about all the other symptoms, the patient's general health, the whole shebang. So yeah, a low-grade 99-degree fever in, say, an elderly person who's confused, that is way more alarming than a 101 fever in a young, healthy person who just has a sniffle.
Okay, so let's back up for a second. What even is a fever? Well, think of it like your body's built-in alarm system. Deep inside your brain, there's this little part called the hypothalamus, and it's basically your body's thermostat. When it senses a threat, like a virus or some bacteria, it deliberately cranks up the heat. So the fever isn't the actual disease. It's just a symptom, a sign that your immune system is gearing up for a fight. And the doctor's job? It's not to just hit the snooze button on the alarm. It's to find the fire.
All right, so before any of that cool detective work can even start, there is one absolutely critical, immediate question that has to be answered. Is this person in immediate danger? This is all about triage, about spotting the red flags that scream life-threatening emergency. And believe me, doctors have a very systematic way of doing this.
One of the first tools they use is something called the Q-SOFA score. It's a super fast checklist they can do right at the bedside to screen for sepsis. Now, sepsis is a really deadly condition where an infection just completely overwhelms the body. The checklist is just 3 simple questions. 1, is their breathing rate really high? 2, are they confused or acting differently? And 3, is their blood pressure dangerously low? If you get a yes to 2 or more of those, man, alarm bells are just ringing off the hook. That signals a super high-risk situation that needs action, like right now.
Okay, so once sepsis is on the radar, that hunt for red flags keeps going. And the next stop is the body's command center, the central nervous system. We're talking the brain and the spinal cord.
So any kind of confusion is a massive warning sign. But then you have things like severe neck stiffness. That could be pointing straight to meningitis, which is a nasty infection of the lining around the brain. Or what if they have a brand new neurological issue, like suddenly one side of their body is weak? That could be a brain abscess or encephalitis. Every single one of these, yeah, those are full-blown medical emergencies.
From the command center, the next check is the engine room, the heart and the lungs. Because if there are problems here, things can go south fast.
So if oxygen levels are low, that's a clear sign the lungs are in trouble. And if a doctor hears a new heart murmur, something that wasn't there before, that's not just some interesting sound. It could mean endocarditis, a really dangerous infection that gets onto the heart valves. And then there's a petechial rush. These are tiny little red or purple dots on the skin that don't go away when you press on them. This can be an absolutely terrifying sign of something called meningococcemia, an infection so aggressive it can be fatal in just a matter of hours.
Okay, so let's say we've gone through that checklist and there are no immediate life-threatening red flags waving. Whew! The pace can now shift. We move from emergency response mode into a more methodical investigation. This is where the doctor really puts on their detective hat and starts gathering clues to figure out what's going on.
And this is where things get really interesting, because it's not always an infection. A fever can come from all sorts of things. It could be inflammation from an autoimmune disease, like lupus. It could be from certain types of cancer, like lymphoma. You could even get a fever from a blood clot, or as a weird reaction to a new medication. This cable here, this is basically the doctor's mental map of all the big categories they need to consider. This is why listening to the patient's story is just so important. Doctors are hunting for what they call localizing clues. These are symptoms that act like big, bright signposts. Got a sore throat? Okay, the signpost points to the throat. A cough? It points to the lungs. Pain when you pee? Well, that directs the investigation right to the urinary tract. Every one of these little clues helps narrow down the search from anywhere in the body to a much more specific spot. Now, here's a question that can be a total game changer. And it's so simple. Have you traveled recently? Just that one question can completely flip the entire investigation on its head. A person's travel history, it opens up a whole different playbook of potential diseases, stuff that you just wouldn't normally see at home. It really goes to show context is absolutely everything. So for anyone with a fever who's just come back from certain parts of the world, these 3 diseases, malaria, dengue, and typhoid, they shoot right to the top of the list. And the number one non-negotiable rule is to rule out malaria immediately. Because here's the thing, malaria is treatable, but if you miss it, it can be fatal. It is the one diagnosis a doctor simply cannot afford to miss in someone who has been traveling. Okay, so the detective has interviewed the witness, that's the patient, and examined the crime scene, that's the physical exam. They have a theory. Now it's time to go to the lab for some forensic evidence. We're talking blood tests and other diagnostics that are going to help confirm or, completely debunk the doctor's initial suspicions. Even a basic blood test is packed with clues. Take the white blood cell count. If it's really high, that's called leukocytosis, it usually means the body's in a big fight, probably against bacteria. But here's the interesting part. A low count, leukopenia, can be just as important. It can mean the immune system is totally overwhelmed, like in severe sepsis. Or it could be a specific clue pointing toward infections like typhoid, malaria, or even dengue. And here we have a really cool, more modern tool in the doctor's toolbox. It's a test called procalcitonin, or PCT. And what it does is help tell the difference between a bacterial and a viral infection. Why does that matter? Well, if the level is low, it's almost certainly a virus, which means antibiotics are useless. But if that level is high, it points the finger straight at bacteria. And that gives doctors the green light, the confidence they need to start antibiotics.
All right, so all the evidence is in. We've got the patient's story, the clues from the physical exam, and now the hard data from the forensics lab. The detective is ready to reach a verdict, and that diagnosis, that's what's going to dictate the entire plan of action from here on out.
Now, for those really sick patients, remember the ones with potential sepsis we talked about at the beginning? The action is immediate, and it always follows the ABCs. That's airway, breathing, and circulation. Before they even have a final confirmed diagnosis, the absolute top priority is to stabilize the patient. Just keep them alive.
Okay, so we've just talked about a lot of scary worst-case scenarios, but it is so important to remember this. For most of us, most of the time, a fever is just your body fighting off a simple virus that's gonna go away on its own. And the plan is usually pretty simple, right? Get some rest, drink plenty of fluids, and get what we call safety netting instructions. That's just a doctor giving you really clear instructions on what to look out for and exactly when you need to come back if things aren't getting better.
And ultimately, this is the take-home message. This is the core mindset. Before a doctor ever settles on the easy answer, like, oh, it's just a virus, they have a mental checklist that's always running in the background. They're constantly asking themselves, could this be sepsis? Could this be meningitis? Could this be malaria? It's all about ruling out the killers first. And it's that structured, super vigilant approach that lets them take a simple clue, like a fever, and turn it into a precise and very often a life-saving diagnosis. Makes you wonder, doesn't it? What other common symptom has such a complex story hiding behind it?